On Monday, September 24, 2018, U.S. Department of Health and Human Services Deputy Secretary Eric Hargan paid a visit to the administrative offices of Fairbanks Native Association. He was accompanied by Dr. Deborah Bergeron, Director of the Office of Head Start, and Dr. Eleanor McCants-Katz, Assistant Secretary for Mental Health and Substance Use. The visit was part of a larger effort by HHS officials to tour interior Alaska, its many communities, behavioral health providers, and education outreach programs to better understand the issues Native Alaskans and American Indians face at the local level while delivering HHS programs.
It's important for us to sort of see people who are kind of on the front lines. It's sometimes hard in DC to understand something beyond sort of facts and figures and the paperwork that we're going through all the time, but that's why it's important for us to get out and kind of get the real reflections from the people who are on the front lines implementing these programs. So we're here to kind of figure out what the strengths are of that the programs have, and that what you all are seeing, and also some of the things that don't work in there. And also obviously for us to be able to do all of this in a way that's sensitive to the culture, the customs, the community that you have here in Alaska.
The visit was productive as FNA administration were able to share triumphs and concerns face-to-face with top-level HHS administrators. Deputy Secretary Hargan had a surprise for both FNA and Tanana Chiefs Conference.
Both Tanana Chiefs Conference and Fairbanks Native Associations will be awarded a Tribal Opioid Response Grant. Over the next 2 years, Tanana Chiefs Conference is expected to receive just over $700,000, and Fairbanks Native Association is expected to receive just over $500,000 to increase access to culturally appropriate and evidence-based treatment, including medication-assisted treatment for opioid use disorder. So, I want to congratulate both Fairbanks Native Association and the Tanana Chiefs Conference on these new grant awards from HHS's Substance Abuse and Mental Health Services Administration.
Tanana Chiefs Conference received an additional Healthy Transitions grant to help address youth with serious mental disorders and is expected to receive just under $5 million over the next 5 years. Both FNA and Tanana Chiefs expressed gratitude for the funding.
We're very thankful for the opportunity to expand our services. I think one of the areas that is most concerning to me is our ability to expand our services within our detox program, making beds available for people that have opioid types of issues. And in this particular grant here, I'd like to explore that idea of maybe utilizing those funds for that purpose.
Deputy Secretary Eric Hargan, I just really appreciate you going out to our area and seeing the needs of our people, and that was very important. And the way you were able to say that today was very important to me, because it really was clearly that you heard a loud message. And part of that message was the need for drug and alcohol treatment. And you heard a lot of the concerns of our people talk about the concerns with opioid, but not just opioid, about addictions as a whole. And these two grants are going to be able to help us meet those needs in rural Alaska.
The increase in opioid use is an issue, one that FNA hopes to help alleviate with the new funding.
The treatment of opioid is relatively new to Alaska, and looking at all those resources out there that might become available for us to enhance the services we provide will benefit the people that we serve. As I indicated, we serve the entire state of Alaska, both native as well as non-native. So we're always looking at those opportunities to really look at how we can do what we do better.
The needs have changed a lot and have grown, and it seems like no matter how successful we are in delivering services, that need continues to grow. And so these kinds of opportunities that you all have presented us are very appreciative.
The task now is to utilize the funds offered to their fullest extent.
A lot of these folks also have mental health issues associated with their addiction problem. And so in that regard, I would like to see the possibility of hiring psychologists or psychiatrists to serve all of our consumers in our programs that have issues beyond just the addiction problem. We represent not only the Native community, but all races here in Fairbanks. And we serve all races, rather. And so I think this is going to go a long way in trying to help us address this problem. and I'm very thankful for it.